Diabetes can affect many of us here across the Gulf Coast. It's always a great idea to stay ahead of diabetes and find out ways on how you can prevent it. This morning we have Dr. Anthony Nguyen from Providence Medical Group here to tell us more. Good morning.
Good morning.
We're glad you're here. So first and foremost, we were talking earlier, you always ask your patients, what is diabetes? A lot of the times we don't have an answer.
Yeah, it's kind of interesting, like when people come and they either have diabetes or been recently diagnosed, the first question I always ask them is, you know, what is diabetes, what does it mean to you? And kind of what's the first word that comes in your mind? And what I do find interesting is most people will say something about sugar. My sugar's too high or this and that. And when you really think about it, like high sugar is a symptom of diabetes, but it's actually not diabetes. And so that really kind of throws people in a loop because they're like, well, that's not what I always heard or I thought. So when you talk about diabetes, it's actually a hormonal problem. And so in our bodies, we have an organ called the pancreas. And the pancreas secretes a hormone called insulin. And the difference between type 1 and type 2 really stems in this. In a type 1 diabetic, basically their factory is shut down, and so their body is unable to produce insulin at all, and as a result the treatment for a type 1 diabetic is different. But really today, like when we talk about diabetes, most people think about type 2 diabetes. And so type 2 diabetes is where your body is still able to produce insulin, but there's something wrong with that hormone. Some people will say insulin resistance, like my hormone's not working quite right. And so I think there's still a lot of debate on, you know, what exactly is type 2 diabetes, but at the end of the day, what's important is that there's a problem or a mismatch in the hormone insulin and how your body utilizes it.
Now, why should we be concerned if we're diagnosed with either of those types of diabetes?
Yeah, so type 2 diabetes, for me personally, it's sort of been a passion project of mine. My father actually died from the complications of diabetes at the age of 56. And most of the times in most doctors you go to, they talk about how type 2 diabetes or being diabetic, we usually lecture them and talk to them about like how it affects them and all the organs that it may damage and all the complications from it, but it actually goes beyond that. So when I was 17, 18, is when my dad was kind of diagnosed with diabetes fully. And you can see that having diabetes alone affects not just yourself, but everybody around you too, the family dynamic. As a result of diabetes, he had to stop working, so you look at the social impact of it. And when you look at the statistics currently, there's about 35 million Americans with type 2 diabetes, and somewhere around 85 million who have pre-diabetes, meaning that they're at risk for becoming diabetic or converting over. So when you look at that number as a whole, you're talking about a third of the US population has a disease that roughly shouldn't even exist. It's a disease of lifestyle, it's a disease related to how you treat your body. And so that number is staggering. So when you actually look at the economic impact and all these other things, the social impact, the family dynamic, you know, really it should be a crisis.
Right. Now, if the folks at home, if they're not sure if they have either type 1 or type 2, how can they find out, and how often should we get checked?
I always recommend that people, you know, obviously establish with a primary care doctor. What's good is a lot of employers will do annual health screenings where they'll just check what they call as a blood sugar level. And so there's two ways essentially to diagnose diabetes currently in the United States. And one is using the fasting blood sugar, which is where you go in and if you haven't eaten for about 8-hour period, your blood sugar technically when it's normal should be somewhere between the range of 70 to 100. And once it starts going above that number, somewhere between, let's say, 100 to 126, that's considered pre-diabetes or at risk for diabetes. And once it's over 2 or more readings above 126, then that's considered the diagnosis of diabetes. More commonly now in the office, though, we're using a test called the hemoglobin A1C. And what's shocking to me, too, is that many patients who are diabetic have no idea what a hemoglobin A1C is. And when they don't know that, to me it's like, if you don't know where your goals or where you're supposed to be at, it becomes extremely difficult to manage the disease itself. So one of the things I'd like to talk about is the A1C. I think it's kind of important that everybody kind of get that grasp of that. So the hemoglobin A1C tells us a blood sugar average. And a normal A1C is usually 5.6% or less. And so if you flip that number, 5.6 to 6.5, that it makes the diagnosis of diabetes, especially if it's on 2 or more occasions. Okay, And so once your number is above that, then you probably have diabetes, and that means that you probably need to get checked out.
And finally, if anyone at home has any more questions, where can they find more information online?
So you can go to providencehospital.org, and if not, you can come see me at my clinic, which is Providence Medical Group at Snow Road.
All right, Dr. Nguyen, thank you so much. Of course, we'll have more information on our website, fox10tv.com.